If your lungs are aging faster than your body, you will not know it until you cannot climb a flight of stairs without stopping. Most people never test their lung function. They assume breathing is automatic. It is, until it is not. Here is the uncomfortable truth. Your lungs start losing capacity silently. By the time you feel short of breath doing simple tasks, you have already lost significant function. And that loss predicts everything from heart disease to cognitive decline. So today, I am giving you a simple breath test you can do at home, plus a 5-minute routine that expands your lung capacity week by week. First, the test. It is called the breath hold test. Not a medical diagnostic, but a practical window into how efficiently your body uses oxygen. Here is how to do it. Sit comfortably. Take 3 normal breaths. On the 4th breath, inhale fully, but not to maximum strain. Then hold. Start your timer the moment you stop breathing. Hold until you feel the first definite urge to breathe. Not until you are desperate. Until you feel the first clear signal. Stop the timer. That is your control pause. If you held less than 15 seconds, your breathing efficiency needs work. You are likely overbreathing throughout the day without knowing it. If you held 15 to 30 seconds, you are in a moderate range. There is room for improvement that will affect your energy and endurance. If you held more than 30 seconds, your oxygen efficiency is solid. Your goal is maintenance and gradual improvement. This test comes from the Buteyko method, developed by a Soviet physician who spent decades studying breathing and health. Research published in respiratory journals has shown that improving this number correlates with reduced asthma symptoms, better sleep, and improved exercise tolerance. If you are realizing that you have never thought about how you breathe, you are like most people. Subscribe because I share these overlooked health markers every week. Now let me show you how to improve your breathing in 5 minutes a day. Minute 1. Nasal breathing reset. Close your mouth. Breathe only through your nose for 60 seconds. Slow inhales. Slow exhales. If this feels difficult, that is your first sign that your breathing pattern needs work. Your nose filters, warms, and humidifies air. It also produces nitric oxide, which improves oxygen absorption. Mouth breathing bypasses all of this. Minute 2. Extended exhale. Inhale through your nose for 4 seconds. Exhale through your nose for 8 seconds. Repeat 5 times. The extended exhale activates your parasympathetic nervous system. It tells your body that you are safe. Stress hormones drop. Heart rate variability improves. Minute 3. Diaphragmatic breathing. Place one hand on your chest and one on your belly. Breathe so that only your belly hand moves. Your chest should stay relatively still. Do 10 breaths this way. This trains your diaphragm, the primary breathing muscle that most people underuse. When your diaphragm works properly, every breath brings more oxygen with less effort. Minute 4. Controlled pause practice. Take a normal breath in through your nose. Exhale normally. Then pinch your nose and hold until you feel a moderate air hunger. Release and breathe normally for 30 seconds. Repeat 3 times. This is not about holding until you gasp. It is about gently extending your tolerance. Over weeks, your body learns to function with higher carbon dioxide levels, which paradoxically improves oxygen delivery to tissues. Minute 5. Recovery breathing. Breathe normally through your nose for 60 seconds. Focus on making each breath lighter and quieter than usual. Imagine you are trying to breathe so softly that a feather in front of your nose would not move. This resets your baseline breathing pattern. Most people breathe 2 to 3 times more than necessary. Quieter breathing is more efficient breathing. Now here is what makes this work. Test your breath hold time once per week. Same conditions, same time of day. After resting, not after exercise. Your mission is simple. Add 3 to 5 seconds to your breath hold time every 2 weeks. If you start at 20 seconds, aim for 40 seconds in 8 weeks. That improvement means your cells are receiving oxygen more efficiently. You will feel it in your energy, your sleep, and your ability to move without getting winded. One final thought. Breathing is the only vital function that is both automatic and controllable. That is not an accident. Your body is giving you a lever to pull. Most people never pull it. 5 minutes a day. No equipment. Just air. That is enough to change how your entire body functions. I will see you in the next one.